Hello friends, let us now learn some previous year questions from PG Eimer. True about pityriasis versicolor is. Pityriasis versicolor is also called as tinea versicolor. True. Dobie itch, joke itch, dermatophytes, all these are actually dermatophytes, phytic infections. This tinea versicolor or pityriasis versicolor causes malassezia furfur. Right. Next question. So this Dobie itch or jock itch. So both these are tinea cruris involvement in the groin, that is dermatophyte involvement in the groin areas. True about impetigo contagiosum is. Impetigo contagiosum shows honey colored crust. Osbehausen sign is indirect Nikolsky sign which is seen in pemphigus vulgaris. It is caused by staphylococcal aureus, contagious and also a bullous disorder. Then next question. Dermatitis herpetiformis. Dermatitis herpetiformis is caused by herpes. No, actually dermatitis herpetiformis is an autoimmune disorder where there is accumulation of IgA will be seen. Where you will see accumulation of IgA in the skin or dermal papillae is seen. Affects mainly the flexure surfaces of skin. Actually, this dermatitis herpetiformis will affect the groin, extensor, so not groin, buttock region, thigh region, on the back, especially the extensor region will be affected by this dermatitis herpetiformis. It is associated with gluten sensitivity and dapsone is used for treatment. Next question. Maculopapular rashes are seen in all except. Maculopapular rash is seen in measles, exanthemum, German measles, that is rubella, and infectious mononucleosis. So you will not see any rashes, maculopapular rashes in scarlet fever. In scarlet fever you see desquamated erythema will be seen. There will be desquamated erythema is seen in scarlet fever. Then next question. Androgenic alopecia in female is caused by. Androgenic alopecia in female is caused by Steen-Leventhal syndrome. Yes, because in Steen-Leventhal syndrome there is increased there is changes in hormonal changes is seen in Steen-Leventhal syndrome. So androgenic alopecia is seen in Steen-Leventhal syndrome. Then next question. Findings in psoriasis include. In psoriasis we see parakeratosis, there is micromonroe's abscess are seen. Autoimmune disease with T cell involvement is also psoriasis. 100% of basal cells in multiplication are involved here. Frequently involves mucosal surface. False. Mainly psoriasis involves the normal skin other than the mucosal surface. Next question. True about bullous pemphigoid is. In bullous pemphigoid itching is common. Darier's sign is not for pemphigoid. Nikolsky sign is negative in bullous pemphigoid. It is positive in pemphigus vulgaris. Okay. Even bulla spread sign is negative in bullous pemphigoid and positive in pemphigus vulgaris. It is not actually common in children. It is actually seen in age group between 60 to 80 years of age. Darrier sign is seen in systemic mastocytosis or urticaria pigmentosa. It is seen in systemic mastocytosis or urticaria pigmentosa. Next question. All are true about lichen planus except. Not associated with oral ulcer. No. Lichen planus can be associated with oral ulcer. Vicam striae are present in lichen planus. Colloid body on histology is in lichen planus. Morphology can be represented by 5P. And Kobner's or isomorphic phenomenon may be present in lichen planus. Next question. Which of the following is caused by bacteria? Anal warts are caused by HPV virus. Lymphogranuloma venereum is caused by bacteria, that is Chlamydia trachomatis. Molluscum contagiosum is caused by Molluscum contagiosum virus itself, it is pox virus. Then Condyloma accumulata is caused by a bacteria, that is Treponema pallidum will cause Condyloma accumulata. So lymphogranuloma venereum and Condyloma accumulata are caused by bacteria. Thank you for watching.